Hi, Dr. Harrison here, and in this video I want to talk about some serious conditions that are affecting people here in the United States and around the overseas as well. And those conditions are hypothyroid disease, or hypothyroidism, some people call it Hashimoto's, type 2 diabetes, cardiovascular disease, Parkinson's, Alzheimer's. All of these serious conditions are on the rise, and we know that there's an autoimmune component to them. Autoimmune means that the body is having an inflammatory response and kind of reacting to itself, damaging its own tissues. Well, how do we downregulate that? How do we quell those symptoms or help people suffering with hypothyroid, type 2 diabetes, cardiovascular, Parkinson's, Alzheimer's? Well, the way we do that is first by downregulating that inflammation, by eliminating things that drive inflammation. We know sugar in the diet. Too much sugar drives inflammation. We've got toxins and bad fats. A lot of that we get from our food chain. We're eating processed foods that contain pesticides and chemicals that drive inflammation. They've been laced with hormones and antibiotics. So we need to clean up the diet, obviously, in many cases when we're working with these types of people. But we also have to look at other toxic exposures like heavy metal. We've got mold exposures, Lyme disease. A lot of these different exposures can drive massive amounts of inflammation, a lot of which starts in the gut, and it drives this autoimmune type response. And this is why we see a lot of people with one of these conditions has the other as well. For example, most people who are type 2 diabetes end up hypothyroid. Why is that? Well, they're both driven by inflammation on the cell membranes that are damaging hormone receptors. So not only do you get insulin resistance, you're going to get thyroid hormone resistance. So that's just one example. But inflammation is driving all of these symptoms of fatigue, weight loss resistance, brain fog, cardiovascular, your blood pressure is up, you feel stressed, Parkinson's, Alzheimer's, pre-dementia, forgetfulness, those types of things, all driven by the same stuff. So as I've worked with clients locally here in Florida over the past few years, I found that some of them really didn't need the intensive one-on-one with me. So we would just do an hour consult, kind of straighten out their diet. But for those who really did need it and were kind of being left behind, either they couldn't afford the one-on-one consulting, or they found it difficult to spend the time with me that needed to be spent, I created a membership website, drsteveharrison.com. And if you go there, in the membership program, you can get me by video where I walk you through all the dietary changes and brain and body detox. Over time, you get me on video. And you pay just a nominal fee monthly for 12 months, and then you have lifetime access. Or you can pay one lump sum up front and you'll have a lifetime access. And of course that's discounted if you pay up front. But that way I made sure I wasn't leaving anybody behind. For those of you who really wanted the detox but couldn't afford the time or the money to spend with me one-on-one, because my time is valuable and I can only work with so many clients one-on-one. Some people were being limited in that fashion as well. I just didn't have time for them. Well, I didn't feel good about leaving them behind, which is why I created this membership program. So we've got 3 different options for you. I'm not sure which option will be best. And so what I did to handle that for you is I created a free consultation. And so when you go to drsteveharrison.com, over to the side, you'll see a floating icon that says, click here for a consultation. And you go in, fill out your information. Then it will take you to a calendar where you can actually pick the day and time that you want me to call you, and we'll spend 10 or 15 minutes on the phone completely free of charge, no obligation for anything. And I just want to see what I can do to steer you in the right direction. Maybe you just need a quick diet plan where we spend an hour reviewing maybe your blood work and we go through a few history forms, and then I give you a diet and we kind of clean things up that way. And some people do just fine with just that. If you need a detox program after we talk and I kind of feel, we've had some exposures that maybe we need to do a detox program, but you're the type of person who doesn't need me to hold your hand through that process and maybe you're just not that sick, maybe the membership site might be a great way for you to go through that program at a very affordable price. Or for those of you who are really sick, we might talk and you've tried a lot of other programs, they haven't worked. You're very sick, you're suffering with a lot of different symptoms that we mentioned earlier. Well, then we'll see if we can find some time and common ground to see if we're a match to work together one-on-one. So go to drsteveharrison.com. Look around. There's a lot of great information there. You'll find information on my Cellular Reboot program, which is the membership program where you get me by video. It'll answer most of your questions there. If you have any other questions, of course, you can call the office. Our phone number is there. Or go ahead and schedule for that consultation, and I look forward to speaking with you soon.